Dr. Shane Reti.
Thank you, Mr. Speaker. It's a pleasure to speak to this bill. Mr. Speaker, we support the intention of improved access to healthcare for older peoples, but this bill is not the right tool to do that. It suffers from a lack of understanding of how medical services are provided. It's broad and unfocused, and because of that, it's also fiscally unsustainable, and I'll give examples of all of this. Firstly, Mr. Speaker, let's imagine the deployment of this bill. 3 doctor's visits and 3 free health checks. What is a doctor's visit? Well, you know, that's kind of a hard problem. In fact, academics and others have pondered over that for many years. What is a doctor's visit? Is a blood pressure check a doctor's visit? Is a repeat prescription a doctor's visit? When does a doctor's visit start? Is it when you enter the building? Is it when you check in with reception? Is it when clinical notes are first entered on the computer? You see, all this matters, Mr. Speaker, because as we know from years of medical audit, we need to be able to reliably map service to funding. The details matter. But here in 4 pages, despite others spending many years trying to figure it out, it seems like we've got an answer. The answer is in Interpretation Clause 4. A doctor's visit means a doctor with a general practitioner. What a disservice to the largest medical workforce in New Zealand, to our nursing workforce. Under this bill, this lazy definition, nurses are incapable of undertaking a health check, and I would hotly contest that, Mr. Speaker. Lazy drafting. And what, Mr. Speaker, of nurse practitioners who run clinics in remote regions, Te Hapua, Te Kao, amongst some of the high-risk populations that this bill seeks to reach? They would miss out under this bill's poorly drafted words. A health check. A health check, Mr. Speaker. What is that exactly? Is a phone call a health check? Is a blood test a health check? You know, it would have been so easy to add a bit more detail and carry the intent of the bill by adding one word: preventative. Okay, got it. There's a whole lot of descriptions around what preventative health checks are, but no. Lazy drafting just adds further confusion to an increasingly confused bill. Gets even worse, Mr. Speaker. The bill espouses the aim of, quote, ignoring a minor ailment that could get worse. What is a minor ailment? Because, you know, doctors code in what's called read coding in SNOMED, and there's no code for minor ailments. It just doesn't exist. Lazy interpretation, lazy drafting. But even if we accept that, let's look at 2 scenarios. An older person who thinks they have a minor ailment visits a GP, and in fact nothing is wrong. Do they then have to pay? Conceivably, this could increase the cost to older people. Let's take the other extreme, Mr. Speaker. What about the person who has a major illness who visits under this scheme? Will they be excluded because they don't have a minor ailment? Poor drafting, lazy drafting. Exactly the people we want to target are not targeted, and therein lies the confusion. If we start at the front of the bill, the confusion actually starts in the general policy statement, where it reads, the bill will have far-reaching benefits in terms of social, emotional, physical and psychological well-being. Does the member not think that older Māori might be a target population? And if so, why does this part of the bill completely miss out one of the fundamentals of Māori health, spiritual well-being, completely eliminated in this description? I'm not interested. Under the most common framework for Māori health, Mr. Speaker, te whare tapa whā, spiritual health, is one of those sides of te whare tapa whā. Lazy drafting. It misses the target, and that's important to this bill. Targeting, exactly that. This is a major problem. There's no targeting. Everyone gets 3 visits, despite the fact that 90% of New Zealanders report they are in good, very good or excellent health, and for those over 75, 80% report good, very good or excellent health. There are other targeted tools, Mr. Speaker. Very low cost access, high user health card, prescription subsidy cards. Mr. Speaker, we know the sector would struggle with this bill. As my colleague said, the NZMA Chair, Dr. Mark Patterson, said the policy is unnecessary. Short on detail, short on facts, unsustainable, it's short on everything. It's more of a haiku than a bill, Mr. Speaker. Just short, and I can't commend it at all. Thank you.